We are the team TUBED from Melbourne, Australia. Firstly, I'd like to introduce you to Dr. Vinod and his patient, Uncle Bob.
Bob is 65 years. He is intubated in ICU for 10 days. If I had known he is going to require prolonged ventilation, I could have reduced his risk of delirium and other ICU complications. Currently, it is difficult for bedside clinicians to predict prolonged ventilation. If we have a better tool to predict, we could help many patients like Bob in ICUs across the world. Can machine learning help solve this problem?
Our team set out with two aims. First, we wanted to predict patients who required prolonged ventilation for more than 72 hours so that we can focus on them and intervene to prevent complications and improve their outcomes. Secondly, we wanted to push the barriers of health informatics research. We wanted to break down the silos of information between EMR data and chest X-ray image data and integrate information across different sources to create models that can help improve our patient outcomes.
Within MIMIC4 database, we identified ventilated patients with different durations of ventilation. The idea is to look at patient features from the first 24 hours in order to predict whether the patient is still under ventilation at 72-hour mark. We will exclude population groups that's not intubated at the 24-hour mark, as well as people that are reventilated for the purpose of this datathon. After selecting our patient population, we then asked our team of expert clinicians to identify features that are deemed clinically relevant to our prediction. We also included the MIMIC chest X-ray dataset as part of our features. The selected feature is then passed to a random forest classifier in order to generate prediction model.
Our average patient was 64 years old. There were slightly more males than females in the population, and the majority of cases came from emergency admissions. After excluding patients ventilated for less than 24 hours and those who didn't have associated CXR data, we were left with almost 3,000 patients. Interestingly, these patients were split almost equally across the two groups based on the ventilation duration, therefore creating a perfectly balanced dataset. Here you can see the most notable differences between the two groups. Patients who are required prolonged ventilation are shown in blue and are sicker with higher Apache scores, have higher plateau pressure, have higher respiratory rate, and have higher body temperature. Now, using this population of patients, during this weekend we focused on developing separate models for electronic medical records and chest X-ray data, as well as a combined model to leverage the data from both sources. Our EMR-only model showed promising results with 82% sensitivity and 81% specificity. Adding the CXR data did not improve the performance of the model. However, we believe that better results can be achieved by deriving features directly from original free text reports.
We are aware of the limitation of our datasets and analysis. Some of the limitations are fundamentally related to our design. Our preliminary results are promising, and we are aware that this is just the first step of the model design, just the first step of this long pathway before the translation.
We have now demonstrated that electronic medical records and chest X-ray data can be combined into a single prediction model. And using these algorithms, we can help doctors like Vinod predict prolonged ventilation and improve the ICU journey for the millions of Bobs out there. Thank you.